Thanks. We continue our reopening Arizona coverage with Will Humble. He's the executive director of the Arizona Public Health Association and was the former state health director. Will, first off, what do you think of the governor's decision here?
Well, I think it's a reasonable one, but if you ask me, is it going to have a big impact? I really don't think it's going to at all. I mean, look, the capacity limits were artificial in many ways. They were never really enforced by the state health department. Yes, restaurants were supposed to be at 50% capacity, but I think there were something like 20 enforcement actions over the course of 6 months and tens of thousands of businesses. So it's not like there was a lot of enforcement happening. It could be that some businesses that were like doing the right thing because that's what the rules said might increase their capacity a little bit. But hey, the bottom line is the trends are looking better. Cases are coming down, hospitalizations are dropping, more people are getting vaccinated. But I don't see this as being a real watershed moment because there was so little enforcement to begin with.
Yeah. So for people who are very concerned that they think that this is just moving too fast, we've had about 2 million doses of vaccine given out. About 825,000 people roughly have had COVID here in our state. If not now on some of this, when?
Yeah, well, like I said, I don't know that this really makes that much of a difference. Here's the thing that that really needs to have some scrutiny about today's order that hasn't had a lot of discussion yet, which is what about these big sporting venues like the Diamondbacks, the Coyotes, and the Suns? Because this order impacts that in a big way. The way I read it is that those franchises are supposed to, if they want to change what they're doing now, they need to turn in a plan to the state health department, who can then evaluate that and approve it. And so the question becomes, what is Director Crist willing to approve when it comes to, say, for example, the Suns? So those are big, giant, potentially super spreading type of places that really need to have some in-depth, I think, follow-up with.
Yeah. So what do you think overall the impact of today's decision is going to be?
I don't think it's going to have much of an impact at all. Like I said, the trends are already going in the right direction, but because there was so little enforcement to begin with, I just don't, and many places were exceeding the capacity limits on weekends by a long shot and getting away with it. I just don't see it translating into something significant in terms of spread.
All right. Will Humble, former state health director. Thank you so much, Will. Appreciate your time today.
My pleasure.